Do you have anxiety? Are you struggling right now in this moment? I want you to acknowledge that the reason I'm not doing this is because it's hard for me, not because I'm shying away from something. That difference is sometimes not visible because it's not like I can't do the stage walk, right? It's that the stage walk has costs. The costs are that I might get a headache. The costs are that I might feel very overwhelmed after. Like somebody I've known for very long told me recently that I didn't know that you lived with a disability. And I said, I don't talk about it very much. And he said, but I read your piece and I found it really like moving and powerful. In my head, I was like, why did she never tell me? And I was saying, in sometimes I don't want to disclose because I feel like what value is my disclosure adding? I care a lot about disability. But it also backfires on me sometimes when sometimes I'm in a training room and somebody else is like, why is a non-disabled person training on disability, right? And then I have to be like, but I am disabled. You know, when a child is coming to talk to me about what is bothering them, that doesn't mean that the child is not okay. It just means a child wants somebody outside of the familial unit to talk to. That's what we're supposed to be. That we are supposed to be able to talk about what is bothering us. We're supposed to know, oh, I'm not doing okay, I need support.
Hello and welcome to the India Autism Center podcast. We are the official podcast partners of the Purple Fest Cohort 2025, and I have one of the Purple ambassadors with me today, Srinidhi Raghavan, who's the brand ambassador for the Purple ambassador for Psychosocial Disabilities. She's also the lead of programs at Rising Flame. Thank you so much for joining us, Srinidhi.
Yeah, such a pleasure to be here. Thank you for having me, Nirvana.
Srinidhi, when we talk about disability, people have this vision in their head on what a disability really is. They might think of a wheelchair user, somebody with a cane. People don't really look at invisible disabilities like yours. Can you tell us a bit more about your disability and how, when was it diagnosed and how it impacted your life?
Yeah, thank you so much for asking. You know, I feel like it's such a it has been for me a complicated relationship of accepting the identity, not in a way that I didn't want to be identified as disabled, but the fact that sometimes because of the number of questions you encounter from others, begin to wonder whether you actually quote unquote live with a disability, you know. And one of the things, because I live with anxiety and depression, it's been a very difficult journey because outwardly presenting I can look very happy, you know, and it's something that really confuses and throws people off because they're like, but you look fine, you know, you like in general. But actually, the kind of toll something takes on me is often invisible to everybody else because it's only happening within the home, right? So I think like aptly pointing out that for me, the discovery that it was a disability was maybe about 8 to 9 years ago. And it came from hearing this lawyer who lives with a disability herself speak to the idea of psychosocial disabilities, right? And she moved the concept of disability away from all the medical understanding to just talk about how much does it hinder your participation in society, you know? And I think that shift that she did back then for me was very important because monumentally it shifted my own thinking around it, right? But I think that because I still, even now till today, find my own relationship to disability and my disability complicated. Somebody told me they lived with depression and anxiety, I would be like, oh, that's probably a disability, right? But with my own relationship with myself was harder for me to accept. And not so much because of anything else, but because of the fact that I am what a lot of people perceive as quote unquote high functioning, right? Like I participate in meetings without much problem, right? I can eat, I can stand, I can do lots of things which are traditionally understood as disabilities. So it became complicated to feel it. And just today I was talking to somebody at the event and I was saying that, you know, just the level of sound exposure that the last 5 days has been so high that I've literally craved quiet at the end of the day, right? And sometimes that aspect of how I experience the world is I'm not vocalizing it, right? And one of the reasons that I've also not really, one of the reasons that a lot of invisible disabilities folks also find themselves struggling with this aspect is because it's not the same one day to another, right? Like yesterday, my anxiety was quite okay, right? But today it has not been great, you know? So it's like, because it shifts so rapidly from day to day and it's so dynamic as an experience, that it's not always something that we can communicate. And it requires you to be very, very vocal, right? Like, oh, I cannot stand and do this, right? I remember when we had to go on this stage on the opening ceremony, I was like, the level of lights on the stage, the sound, it was so overwhelming in general. And one of the things we were discussing is that it's complicated to provide reasonable accommodations for these kinds of disabilities because they are different from person to person, right? It's possible that somebody else who has anxiety doesn't feel overwhelmed by lights and sound, right? But it is true for me, right? So I think that difference from one person to another makes it more of a challenge when we're talking about it, right? Like, I mean, it's true also for like wheelchair users, right? Like how much mobility you have, what you can do, what you can't do, all of that is, of course, also different. But I think somehow, somewhere, we have made peace with that fact, right? Because I think the movements of the blind folks, the deaf folks, the wheelchair users is sort of more present or more vocal, let's say, in the years that we have had. The invisible disabilities movements are more, of late, we have been talking about it more, right? So.
Yeah, but if there's no ramp to a stage or there's no sign language interpreter,
Yeah.
it would still be considered publicly like a violation. Do you think your accommodations are not respected? I mean, by your accommodations, I don't mean Srinidhi's accommodations, but people with invisible psychosocial disabilities. Do you think those they are not these accommodations that you require are not respected enough by society?
I think there's a one of the things that I actually struggle with is when people ask me what accommodations you would need. I find the response to that question itself difficult, right? For instance, I'm asked at most events, and that's part of the reason because I live with chronic illnesses. So my compromised immune system makes me very vulnerable to viruses, right? And I was at a event at one point, and somebody told me, "Why can't you take out? Can you take out your mask so that we can stay for the photograph?" And I was like, "But the virus is not going to be like, this is the photograph. Let me not come and attack her." But nobody would ever think of saying that to a crutch user, right? Or to somebody who is in a wheelchair. You would never say, let's take this out of the picture, right? So I think you're right. In some ways, there's less understanding around what counts as reasonable accommodation because it's not like RAMs, sign language interpretation, braille, screen reader accessibility. We've been talking about this for a while, right? I would think that one of the ways in which we do support folks who have chronic, who have like anxiety, etc., is to be like, you prepare them better for questions, right? Like if you're going to a panel, then you get the questions beforehand, you know where you have to go, those kinds of things. So it's like they feel better prepared, you know, both emotionally and mentally. And I think that those kinds of things, or that we reduce how much sound there is in their exposure. So I think that we are still navigating and negotiating what those things are within the community. And I think that's also one of the reasons that it becomes important for us to talk about it in like, let's not dismiss the fact that it was hard for you, right? I think at this point I'm almost like, I want you to acknowledge that the reason I'm not doing this is because it's hard for me, not because I'm shying away from something, right? Because I think that difference is sometimes not visible because it's not like I can't do the stage walk, right? It's that the stage walk has costs. The costs are that I might get a headache. The costs are that I might feel very overwhelmed after, right? The costs are those. So it's not, in many ways, the costs are not, uh, whether they are non-negotiables or not, changes from person to person. So I think that's one of the reasons why it's there. Whereas if you say there is no ramp, then there is no way this person can get on the stage, right? The cost is very directly proportional.
It's very black and white.
Exactly. Whereas it's not true like that for many of us with invisible disabilities, right? One of my biggest challenges has been navigating airports, right? Um, I try very hard to land from a small airport into another small airport, right? Like if you land in T3 in Delhi, then by the time I get out of the airport, I'm exhausted because of how painful it is for me to navigate such a large space, right? And often they don't give me buggies because they are like, you look fine. Two, you're not elderly. And what are you going to do with the buggy? All right. And I often feel like, why is that a reason to not provide anybody with support, right? Like, I would say that if somebody is just feeling sick and they took a buggy in the airport, it should be fine, right? Like, what is the, it's almost like, are you deserving of this reasonable accommodation? And I think that's the problem.
The same thing started happening about wheelchairs in airports as well, right? Where they now start looking whether you need a wheelchair or not.
Yeah, and I think that because we are not asking because the resources are few, it's like, oh, are you really disabled, right? So because recently with Rising Flame, we released this mental health collection, which was a series of like 14 articles, reports, comics, etc., all on people with disabilities and their mental health. Some of us live with mental health conditions, but some of them were just people with disabilities navigating their mental health, right? Like a deaf person was speaking about the toll of isolation on mental health, because around a dining table, nobody talks to you. Then you constantly feel left out of conversations, and the toll that that takes. And I wrote a piece for that collection also, but my piece was, am I really disabled? Right? Because it's a question that people often ask me, right? Like, are you really disabled? And I think that it was such I still don't know how to answer that question, right? Because it's almost feels like I need to prove that I'm disabled in order to access these supports. But that's not fair, right? It shouldn't have to be that way.
I'm glad you mentioned therapy, etc. And I'm looking forward to reading your article because there are a lot of deaf people who approach me and say that, we have some anxiety or something. And we obviously cannot take our own child, who's our main sign language interpreter, to a therapist. There are no sign language interpreters who understand, no therapists who understand sign language, etc. And psychosocial disabilities can operate at an intersection. Similarly, there are a lot of queer folks who say that, our requirements are not even understood by therapists, etc. So, what do you think of the intersection of psychosocial disabilities with other challenges, and how can those problems be solved?
So actually at Rising Flame, we have a mental health vertical where we are working with all therapists to look at the impacts of ableism on mental health of disabled people. Not just people who live with psychosocial disabilities, but everybody, right? Like one of the things that, say you are coming to any event, right? Your first questions would be around where is the entire event wheelchair accessible, right? And some of us that builds an anxiety, which is like, oh, what if it's not accessible? How am I going to do it? Where am I going to go to the bathroom? What are the supports I'm going to need? Are there volunteers who will help me to eat? These kinds of things that automatically perhaps run in your brain when you have to do an event that's, say, not by a disability organization. What kind of toll does that
And I'll tell you
take?
something funny. I've
Yeah.
invited to so many events to talk about disability, and the venue was not accessible.
I can completely imagine. Oh, God. So I think our approach has been, how do we make normalized conversations about mental health, and how do we sort of think about mental health beyond psychosocial disabilities, right? Because there is a toll of constantly being told that you are not valuable, right? Which a lot of people are told, right? And I know from hearing you over the years that was one of the first things somebody said to your parents, right? And of course, you have there are supportive parents, and because of which we can do a lot of things. But so many young people with disabilities often tell us that my parents don't think I can do anything, right? So the opportunity is completely taken away, and when that opportunity is taken away, there is often a toll on mental health, right? So what we have actually done in the last few years is, since 2020. 2021, we have published 3 mental health manuals that focus on different aspects of disabled people's lives, right? And we are working with mental health professionals in order to train them. for this. In like we basically do a 3-day training program with them based on the manuals that's executed by us. But it's led, our team on this is led by Rising Flames mental health consultant, who herself is a mental health professional and lives with a disability. So this kind of direction that it brings us, because she has studied psychology, she understands it, and she's also the author of the manuals. And what we attempted to do with it is we tried to center persons with disabilities experiences, right? So the first manual was just how does ableism impact us. The second manual, we looked at invisible disabilities and intersectionality, like how does caste and disability come together, and what does that mean for mental health? How does queerness and disability come together? What does that mean for mental health? And our most recent manual was on relationships. Like, what are the kinds of things that persons with disabilities who may be going to therapy, what are they bringing up with regards to relationships in the conversation, right? Because often it's like, I don't want to be dependent, I don't want to share my needs, right? And a lot of the question is, for many of us with invisible disabilities, the question is, when do I tell this person that I have a disability, right? Because it's a question of, once you disclose disability, often people are uncomfortable with it, right? And it's such a complicated thing for people with invisible disabilities. But for people with visible disabilities, it's an unfortunate reality. You have to share it anyway, right? So we sort of looked at this spectrum of what are the different ways in which this does impact.
But if somebody with an invisible disability is watching this program, what advice would you give them, say, if they're applying for a job? Should they openly mention on the CV that they have an invisible disability so that a corporate would be more open in terms of the reasonable accommodations, or do they have a right to stay silent about an invisible disability? I don't think there's any right or wrong answer on anything, but just picking your brains on that.
At Rising Flame, one of the things we do in our interviews is we ask whether or not we know and that person has disclosed or not. One of the questions is, what reasonable accommodation do you need in order to work? Because we're a cross disability team and our access needs sometimes conflict with each other. But we have to build that environment where everybody's access needs are in some way met. Say there is somebody who struggles with attention while we leave voice notes for something, then we ask them to take notes while the voice note is happening, right? A lot of reasonable accommodation for invisible disabilities is also us discovering what helps me, right? What could possibly be different if I had to be there? And I think in some ways we don't want to disclose our disability because we think it's going to work against us, right? Especially mental health conditions. There's a lot of stigma, right? It's like, oh, she's depressed, she can't do anything, right? And that's possibly true for somebody who's really struggling, right? But it's the fear that if we disclose, then they will not hire us, right? That's one thing. The second thing is that I think there is very little understanding of how can I support myself when I have an invisible disability that may impact the work I am doing, right? I can just give you from my own example. One of the things that we began to do when I started to travel for work is that we would try to keep a separate, like I would be in a single occupancy room, and we began to request it as reasonable accommodation. Part of the reason was because I needed that shutdown at the end of the day that had no interaction with another human, right? Which is something I can manage in my own house, but I can't manage it when I'm traveling for work. And it really began to help me to understand, oh, I actually do need that 1 hour, 2 hours, or the night where it's just me in order to be able to wake up in the morning and do what I need to do, right? But that reasonable accommodation discovery happened because we tried it once and it seemed to work, and then we continued. I think a lot of people don't know what that thing is that would help them to do better, right? And maybe they do, a lot of other people do. And it's a tightrope walk sometimes, because sometimes when for instance, when I disclose my mental health conditions to doctors, because very recently I had to disclose it because the doctor asked me, what are the medications you're on? And I listed the mental health medication that I was on. And he told me, you come back and see me after you get off these medicines, right? So there is an active stigma for being on the medicine. And he told me, you can take life very chill. Life is cosmic, life is large, you don't have to worry about it. I'm like, and then he said something about smiling and breathing deeply, etc. And I was like, I've lived with this thing for 20 years. Is it really possible you think I don't know that I need to take deep breaths? But so the disclosure impacted whether I got actual access to healthcare, right? So I know the disclosure is has impacts, right? But what I think is helpful is if employers begin to ask the question, right? If they ask the question, what are the supports you need? Even if you're not asking the question from a perspective of this person lives with a disability, but what are the supports you need is a really, really helpful way for us to proactively provide support, right? And I think, like, because one of the things that I do think that corporates can do, which other organizations can do, is provide well-being support, right? Whether people want to go to therapy and want to pay for therapy, because often it's not, I mean,
Any corporates that are role models in this?
So I actually don't know. Any names aren't coming to mind immediately, but I've heard from several people that often organizations now provide well-being support. Right? It's like maternity leave in many ways. It's a day for you to be to find access to this kind of thing, and then I think some monetary support, because therapy is now quite expensive. So people who may be struggling may need therapy and may not be able to pay for it. So I think organizations providing that support would be great also. And lastly, I think it really is about making it normal to talk about it, right? Do you have anxiety? Are you struggling right now in this moment, right? It's a question that I sometimes ask other people, even in our team, because I think I want them to know that I am seeing that they are struggling, right? And the struggling is not the problem. It is what can we do to make the struggle less, right? And I think that that's the conversation that has to happen, because it's not helpful to be like, oh, I live with anxiety, hence I cannot do any jobs, right? Because that's not true. It's just how can the job be better support for you while you are working in this.
I'm going to ask you a question that I might even get trolled for because you're also leading programs at Rising Flame and you're also in charge of efficiency of your team. So how do you balance these accommodations while also ensuring that somebody in your team also stays efficient to the job? Because a lot of corporates, while might want to provide these accommodations, they are also at the end of the day in the business of business for profit.
I mean, I think it's a difficult conversation to have with team members, right? In that, if you are struggling right now, should you step away? Should we hand this specific thing to somebody else, right? Um, Sometimes what we do is we intuitively see, oh, this person is struggling with this task. Maybe one of us should do it instead, right? So that kind of balance is something that is attempted. But it is difficult, like you're saying, not because of anything else, but sometimes the forces are not internal, right? Like if I have to submit a report in at this deadline and it won't happen, I don't know. It's very hard for me to explain to, say, funders or outside parties that something cannot be submitted because my team member is not doing well, right? So we just try to manage the resources and the energies within the team. But what you're saying is that I think that it's an unfortunate what do you say, connection that has been made, right? And that's one of the reasons I think that people don't want to disclose, because they feel like if they disclose, then they will not be allowed opportunities, etc., right? And I think the conversation needs to shift to what are the kinds of ways in which support can be managed, right? Like, I'm not saying every organization has to provide mental health support, because for some it may not be budgetarily possible in the moment. But what else can you do to make your environment viable for your people, right? Instead of placing the onus on me to disclose, is there a way for us to um, uh, make it forthcoming that we are advocating for disability in an open way, right? Like somebody I've known for very long told me recently that I didn't know that you lived with a disability, And I said, I don't talk about it very much. And he said, but I read your piece and I found it really like moving and powerful. In my head, I was like, why did she never tell me? And I was saying, in sometimes I don't want to disclose because I feel like what value is my disclosure adding, right? I care a lot about disability, but it also backfires on me sometimes when sometimes I'm in a training room and somebody else is like, the why is a non-disabled person training on disability, right? And then I have to be like, but I am disabled, right? So I think the disclosure is also it's a double-edged sword one way or the other, right? Because often the reason I don't disclose is because people give me advice. I really don't want any advice. you know? Like those it's I can't explain how much I might have tried the thing you're advising me to do, right? So it's not helpful.
That everybody goes through. I've been recommended so many doctors and Godman, you won't even believe it.
Yeah, exactly. And I feel like that definitely is the overlapping disability experience, right? They're constantly trying to cure all of us. Yeah.
You are a big self advocate, and I think everybody has a right whether they want to disclose or not disclose. But therapy is also a big taboo because of which people don't even work on themselves sometimes. How can this taboo? How can we as a country remove this taboo around therapy?
Very interesting, because I also, I mean, I started going quite early. I was 19, I think, and part of the reason that I knew that therapy was a thing that I could access was because my sister was a therapist. And I had reached out to her and said she was not living in the same city as me at that point. So I reached out to her and told her, I think I need therapeutic support because it was a very difficult, depressive spell, you know. And she spoke to my parents, because I was not earning. There was no way that I could have paid for therapy. So I needed them to be able to pay. And she advocated for me in order for me to receive therapeutic support. And since then, I've had a lot of people talk to me about therapy in many different ways because I've been in and out of therapy for many years now. I find like it's in some ways it's like it's like doing exercise. It's a way to train your brain to not react in particular ways, right? For instance, like one of the things that I often say to others is that my nervous system goes into fight flight very easily. Suddenly it's ready to run because somebody asked me a question that reminded me of something that was a bad memory, let's say. And that shift, I have to tell my brain, you're not actually in a war situation. You're not actually in a bad situation. This is discomfort. You need to sit through it. That language only came because I went to therapy. I was only able to see how difficult it was for me to do that in the moment because I was in therapy. And then one of the reasons I advocated to people, I say, go to therapy. But your therapist is not only meant to be like, it's okay. Your therapist is meant to give you tools to deal with what you're struggling with, right? And that is something that therapists are good at doing, but it also requires me to do it, right? Like I can go to therapy. It's like also physiotherapy, right? Like which lots of disabled folks experience. I can't only go to the physiotherapist to do physio. I need to do it through my week, right? The practices and the exercises and the things that the therapist provides you are things you practice, right? And I think the hardest part about it for me, for my own self, has been when I have a bad period. I'm sudden again, like even in recent years, I suddenly think, oh God, I've made no progress in 20 years, right? It's a very harsh language to myself. Then I'm like, no. It's just bad spell. Need to practice the things that you were doing. Because sometimes it's like my anxiety can be quite bad if I've not had enough downtime. If I've spent a lot of time interacting with people, then my anxiety gets worse, right? So it's like a muscle. I need to keep working on it, which is like, okay, I didn't do the thing that helps me to interact with people. So now I need to do that thing. Right. So I need to do things that will calm me, that will build my inner strength, that will allow for quiet, etc. But that's the navigation and the skills that I knew I needed, but I only learned it because I was going to therapy. It's not always true. I think the stigma really is about looking at it like going to the gym, right? Because I also work
And I
at
think it's
a
changing in younger generations.
yeah. Because I also work at a learning center here in Goa where I provide social, emotional, and disability support to the children, ages of 10 and 17. And I see some of those children, they come talk to me about what is bothering them. And often I have to tell people that, when a child is coming to talk to me about what is bothering them, that doesn't mean that the child is not okay, right?
Mhm.
It just means a child wants somebody outside of the familial unit to talk to, right? And that's okay. That's what we're supposed to be. That we are supposed to be able to talk about what is bothering us. We're supposed to know, oh, I'm not doing okay. I need support, right? That is a good response system for us to have. And so we should encourage children to have that response because then they'll know I'm not doing okay, and she is a safe space, so I should go to her, right? That's a good response system, and that's why I feel like that's how we should think about it. Not think about it like only people who have very severe mental health conditions need to be in therapy. All of us can be in therapy because it's like a self improvement. I mean, it has a self improvement vibe, but it's basically meant to build our inner strength and resilience.
What would be your advice to a parent of a young person with a psychosocial disability?
I would say get them the support they need for sure, and I think it's okay. It's not something that's life shattering or ends all possibility. It's just about finding the tools for it, right? And definitely, I think I would say uh, more ways for us to temper our responses to children that are experiencing, say, self harm or are talking about, are having suicidal ideation, is to not be like you can't do it, right? Is to find ways for the child to be like, why are you thinking about this, right? Asking the questions to the child, because I think it distress tells us something else is happening, right? And we need to respond to the something else that's happening and not just stop the distress from happening, right? Because that basically means the child stops talking about the fact that they are not doing okay. Whereas we want children to be able to talk to us about the fact that they're not okay, right? Because of late, you might have seen many stories, especially from the US, where young, like 17, 18-year-olds were using ChatGPT to talk about, or we were using an AI chat bot to talk to, right? When they were not doing okay. And I don't think that is the problem, right? It's loneliness. We are not talking about the fact that somebody may not want to live, right? So we have to somehow make it easier for children to talk about that so that they can receive the support they need, rather than us um, being like reacting in a way that is like, oh, I need to protect you, which is not a bad reaction, only it's not enough. The child needs to know that it's okay to not feel okay.
I've taken a lot of your time, so I want to ask you one final question that I've been asking everybody who's come on this podcast. What do you think can the common citizen of India do to make India an inclusive country for people with disabilities?
One of the things would be to not assume when you look at anybody that they are disabled, non-disabled. This is a thing that I have been trying to practice for myself also. Um, it's that because of the fact that there are so many invisible disabilities, I try to not bracket someone as disabled or non-disabled. It's like there's no need to do it. So disability comes in different sizes, and for us to internalize in our heads that, right? Because otherwise we walk into room assuming everybody's non-disabled and we behave in a particular way, right? But if what if we flipped it and we just assume that people have disabilities and navigating society is difficult for many of us, right? I think that will help shift this idea of the very basic idea of when you think about disability, you see a cane, you see crutch, you see wheelchairs, right? What if you just see a human, right, who's struggling?
Thank you so much, Nidhi. Thank you for joining us on the podcast.
Yeah, this was amazing. Thank you so much. I'm so happy to be here. Yeah.